Now if we do a scapular superior glide, this is one that is essentially used for most of the shoulder motions that are going to be reaching upward. So in order to carry out a superior glide of the scapula, you're going to center yourself at the scapula. I'm going to use my right hand, not necessarily as a stabilizing force, but more as a monitoring force to the scapula. And then my left hand would be the mobilization hand, is going to be on the inferior angle of the scapula, right here. I'm going to make sure I've got both borders, the medial and lateral borders, and I'm going to move it upward, directly upward, to work towards superior glide. Just to bring up body mechanics principles here, this is one of those where I'm actually pushing, therefore my left foot is generating the force and I'm moving it through my trunk in through my arm. The next motion that we'll be doing is scapular depression or inferior glide, and this helps the motions of shoulder extension and shoulder external rotation. So when evaluating, if you see limitations in any of those motions, this would be one that you would want to evaluate and possibly treat. This is going to be the opposite of superior glide, where my right arm is going to be the mobilizing hand, my left hand is going to be the monitoring hand. I'll take the heel of my hand, both the thenar and hypothenar eminences, over the superior scapula, and I will be moving in a downward or inferior glide to the scapula. Again, note the forearm is my guide, and that helps me be more accurate with my mobilization. We're going to start with IP distraction, and in this case we're going to use the PIP joint. In that case we want the proximal phalange supported and stabilized in a lateral pinch manner, and then we're going to laterally pinch the middle phalange in this case and gap the skin and distract. Now this is a component motion. I'm sorry, it's actually a joint play motion for both flexion and extension of the IP joint. So by joint play, remember I'm saying that it doesn't necessarily occur with flexion extension, but it's necessary for flexion and extension to occur in a normal fashion. Now, with the ring or small finger, in this case I'll use the ring, I'm going to stabilize it. And then I'm going to laterally pinch the middle phalange. I'm going to distract.